More details now on the coronavirus outbreak. The number of confirmed cases has risen to more than 73,000. The death toll is higher than 1,800. For the latest on coronavirus fears and impact on public health and business, let's welcome Dr. Scott Gottlieb, former FDA commissioner, now a CNBC contributor. He sits on the boards of Pfizer and Illumina. Scott, it's good to see you this morning. Thanks for joining us again. This should be twice a week, 3 times a week, maybe, that we have you on at this point. There have been some figures coming out that you've been able, with your eye, to look at in terms of predispositions and mortality rates and whether there's genetic factors involved with who gets it and who's able to handle it more. Have you delved through that data, and do you have things you didn't know from last time you were on, or that you're indicating to you that you didn't know?
Well, I don't think there are genetic factors. This is a human disease, and it's going to affect humans evenly. China put out some very detailed data on who's been affected and who's succumbed to this virus. And what you're seeing is, a rather unusual age distribution where people under the age of 20 really aren't being stricken. So only about 2% of the cases that they reported out of more than 40,000 cases were under the age of 20. 60% were between the ages of 30 and 60. But again, most of the deaths were clustered in those above the age of 60. So it does appear that while older people are succumbing to the virus, a lot of middle-aged people are getting, pretty severe disease or more advanced disease, because China's really only keeping track of people who have significant symptoms. The mild and moderate cases are probably going unreported. So it is unusual to see so few children actually being reported. What you surmise from that is probably a lot more kids are getting sick, but they're getting such mild disease that it's not even getting reported to the authorities.
Do you see any slowdown in the rate of spread in the last 3 days that we saw? We were briefly optimistic, and then they changed the method that they were using. But again, was it not as bad over the weekend as we had feared? Are there reasons for hope, Scott, or do we believe what we're hearing?
Well, I think, unfortunately, we need to look past China. I mean, we need to pay attention to what's going on in China. There's certainly a lot of suffering there, but we need to look in other nations as well and what's happening there. Singapore seems to be getting control over what was an outbreak in that city-state. But Japan appears to be on the cusp of a large outbreak and maybe epidemic growth in Japan. We need to watch that very closely. They've had a doubling of cases just in the last 4 days. So if you start to see this become epidemic in other nations, or have other nations experiencing large outbreaks, that's going to be extremely worrisome, that we're not going to be able to control this globally. And as far as China's concerned, you've seen a decline in cases in the Hubei province, where they've imposed effectively martial law. It's unclear, though, what's happening in other cities in China. For a while, they were only testing people in other cities who had traveled from Wuhan. So if that's still in place, and since there's no one traveling out of Wuhan anymore because they're all locked up in their house, you'd expect to see the reported cases go down in other China cities. So we really don't know what's happening in China and whether or not there could be epidemics taking root in other cities in China right now.
Scott, as you get more information about this disease and where it's going, do you have a sense of how this compares even to other epidemics in the past and even to the flu? I mean, we know in the United States, as many as 60,000 people die from the flu just in the United States. So how is this comparing, and how are we going to look back on this? Are we reacting properly, overreacting, underreacting?
Well, I think this is extremely worrisome. There's a lot we don't know right now. If you remember with the swine flu, H1N1, when that initially took root, it was first diagnosed in the United States in April of 2009. We thought that was going to be very severe. It turned out to be less virulent than we first feared. This one's unclear, and we're going to learn a lot more as we go, but it appears to be the case that this is probably more contagious than seasonal flu and more virulent in terms of its potential to cause death and significant disease. The case fatality rate, how many people succumb to the infection per 1,000, looks like it could be as high as 2, and maybe it's going to settle down maybe at 0.5 once we have all the data in about how much mild and moderate disease there is that's going undetected right now. To give you a basis for comparison, flu is 0.1 to 0.05. So that's significantly higher. If you have, 1 extra death per 1,000 or maybe more than that, that's pretty significant. And it looks like the number of new infections per infection might be as high as 3 or 4. With flu, it's 1.3 typically with a seasonal flu. So what we call the R naught is 1.3, meaning there's 1.3 new infections for every infection you have. But with coronavirus, it appears to be on the order of 2 or 3.
I wonder if you still feel there will be pockets here in the United States, and does the bringing back the Diamond Princess patients, is that something that could exacerbate that or increase the possibility of that, Scott?
Well, repatriating Americans won't, because we'll keep good control over those individuals and make sure they get good care. But it does appear that we might have some spread that we're not detecting right now, and we're just implementing a sentinel surveillance system.